Welcome to the another video of Microbiology and Immunology Unit-1, second video, Clinical Bacteriology. 1. Methods for identification and antimicrobial susceptibility testing of bacteria. A. Identification methods. Microscopy, Gram staining, acid-fast staining, Ziehl-Neelsen. Culture techniques, use of selective and differential media, e.g., McConkey, blood agar, mannitol salt agar. Biochemical tests, catalase, oxidase, coagulase, indole, citrate, urease, TSI, etc. Automated systems, V-2, BD Phoenix, MALDI-TOFMS, mass spectrometry. Molecular methods, PCR, 16S rRNA sequencing, nucleic acid hybridization. Serological tests, ELISA, agglutination tests, and immunofluorescence. B. Antimicrobial susceptibility testing, AST, methods. Disk diffusion, Kirby-Bauer simple and widely used method. Broth dilution method, determines minimum inhibitory concentration, MIC. E-test, combines aspects of both disk diffusion and MIC determination. Automated AST, systems like VITAC, Microscan. Molecular AST, detects resistance genes, e.g., MICA for MRSA. 2. Quality control, safety precautions and disposal in bacteriology labs. A. Quality control methods. Use of ATCC control strains for media and reagent validation. Daily/weekly QC of culture media, antibiotic discs, and stains. Documentation and regular calibration of equipment, incubators, autoclaves. B. Safety precautions. Use of biosafety cabinets, BSC, for handling pathogens. Wearing PPE, gloves, lab coats, face shields. Hand hygiene and disinfection protocols. No eating or drinking in lab areas. Proper labeling and storage of infectious materials. C. Disposal of contaminated materials. Autoclaving before disposal. Use of biohazard bags and sharp containers. Chemical disinfection, e.g., 1% sodium hypochlorite, for surfaces. Adhering to institutional and government biohazard regulations. 3. Classification, culture, morphology, identification and sensitivity of common bacteria. Bacterium gram stain morphology culture characteristics identification tests common antibiotic sensitivities. Escherichia coli gram-negative rod grows on McConkey, lactose fermenter, pink colonies, indole plus, citrate, urease, sensitive to aminoglycosides, cephalosporins, variable resistance. Staphylococcus aureus gram-positive cocci in clusters golden yellow colonies on nutrient agar, beta-hemolytic on blood agar catalase plus, coagulase and sensitive to penicillinase-resistant penicillins, MRSA variants common. Streptococcus pyogenes gram-positive cocci in chains beta-hemolysis on blood agar catalase, bacitracin-sensitive penicillin-sensitive. Pseudomonas aeruginosa gram-negative rod green pigment, pyocyanin, fruity odor oxidase plus, citrate and often resistant, sensitive to piperacillin, ceftazidime. Klebsiella pneumoniae gram-negative rod with capsule mucoid colonies on McConkey urease plus, indole, cephalosporins. Carbapenems, some strains are ESBL producers. Salmonella species gram-negative rod non-lactose fermenter on McConkey H2S production on TSI, urease, sensitive to ciprofloxacin, ceftriaxone. Neisseria gonorrhoeae gram-negative diplococci requires chocolate agar with CO oxidase plus, glucose fermenter only ceftriaxone sensitive, resistance increasing. Mycobacterium tuberculosis acid-fast rod, non-modal, Lowenstein-Jensen medium, slow-growing acid-fast stain, PCR isoniazid, rifampicin, resistance is a concern. Multiple choice questions, MCQs. 1. Which of the following media is selective for gram-negative bacteria? A. Blood agar. B. McConkey agar. C. Chocolate agar. D. Nutrient agar. Answer, B. 2. Which staining technique is used to identify Mycobacterium tuberculosis? A. Gram stain. B. Albert stain. C. Ziehl-Neelsen stain. D. Leishman stain. Answer, C. 3. What is the purpose of the Kirby-Bauer method? A. Bacterial staining. B. DNA isolation. C. Antimicrobial susceptibility testing. D. Identifying fungi. Answer, C. 4. Which bacteria is identified by the coagulase test? A. E. coli. B. S. aureus. C. Streptococcus pyogenes. D. Klebsiella pneumoniae. Answer, B. 5. Which organism produces a fruity odor and green pigment on culture? A. Klebsiella pneumoniae. B. E. coli. C. Pseudomonas aeruginosa. D. Salmonella typhi. Answer, C. 6. Which of the following is catalase positive and coagulase negative? A. Staphylococcus epidermidis. B. Streptococcus pyogenes. C. Neisseria gonorrhoeae. D. Salmonella typhi. Answer, A. 7. What does a pink colony on McConkey agar indicate? A. Non-lactose fermenter. B. Motile bacteria. C. Lactose fermentation. D. Capsule formation. Answer, C. 8. Which organism is acid-fast positive? A. Neisseria gonorrhoeae. B. Mycobacterium tuberculosis. C. Salmonella typhi. D. Pseudomonas aeruginosa. Answer, B. 9. Which test differentiates between Staphylococcus and Streptococcus species? A. Urease. B. Indole. C. Catalase. D. Coagulase. Answer, C. 10. Which of the following is used for molecular identification of bacteria? A. TSI test. B. Catalase test. C. 16S-rRNA sequencing. D. Citrate test. Answer, C. 11. What is the first step in quality control in microbiology? A. Waste disposal. B. Gram staining. C. Use of control strains. D. Media incubation. Answer, C. 12. Which media is enriched and used for Neisseria gonorrhoeae? A. Blood agar. B. Chocolate agar. C. Nutrient agar. D. McConkey agar. Answer, B. 13. What color colonies does Klebsiella pneumoniae form on McConkey agar? A. Colorless. B. Pink and mucoid. C. Green. D. Yellow. Answer, B. 14. Which bacteria shows HS production in TSI agar? A. Salmonella spp. B. E. coli. C. Staphylococcus aureus. D. Pseudomonas aeruginosa. Answer, A. 15. Which antibiotic is Streptococcus pyogenes most sensitive to? A. Ciprofloxacin. B. Penicillin. C. Tetracycline. D. Gentamicin. Answer, B. 16. What is the proper disposal method for contaminated petri dishes? A. Washing with water. B. Incineration. C. Freezing. D. Drying. Answer, B. 17. Which bacteria is a non-lactose fermenter and urease positive? A. Klebsiella pneumoniae. B. E. coli. C. Staphylococcus epidermidis. D. Neisseria gonorrhoeae. Answer, A. 18. Which test detects methicillin resistance in Staphylococcus aureus? A. Citrate test. B. Oxidase test. C. Mica gene detection. D. Urease test. Answer, C. 19. Which safety equipment is used when working with airborne pathogens? A. Microscope. B. Centrifuge. C. Biosafety cabinet. D. Laminar airflow. Answer, C. 20. What is the role of sodium hypochlorite in labs? A. Nutrient enrichment. B. Media preparation. C. Surface disinfection. D. Gram staining. Answer, C.